Hey guys, welcome everyone to another one of our live streams this week with our Meta-Analysis Academy alumni who matched this cycle. So really glad to have Mangesh Kritya here. He's going to share his really impactful story. Mangesh is from India, as you guys are going to hear from him in just a second. And we're recording this on Thursday of match week. So he just matched. He just matched this week in internal medicine, future cardiologist. That's the plan. So Mangesh, thank you so much for joining, for sharing your beautiful story. Let's start with how did it feel on Monday when you opened that email and you're like, oh, you matched, Tell us what that felt like.
Oh, absolutely. First of all, thank you so much, Dr. Cardoso, for having me here and letting me share my story. And speaking about Monday, I would say it was a very thrilling experience, to be very honest. I was anxious before that, putting in so many years of effort, and there's just one email which will decide how the next of your life is going to be. So I was very anxious and kind of excited at that moment. And the moment I received that email, I felt relieved. That was the first emotion that I had.
Yeah, no, it's pretty incredible. It's such a relief, right? I met a few students here in Boston this week, including Shamuk, who you know well, and
Absolutely.
I asked him, "Hey, what did it feel like for you to get that match announcement?" And a few of them said, "Well, it was mostly like relief rather than just
Yeah,
like overjoyed too, of course, but just relieved, after so many years of hard work and dedication. It's great."
absolutely.
I guess we're gonna build out like an X-ray or a map of your application. I want to figure
Mhm.
out like what were the strengths, what were the things that you did. So let's start out with a quick introduction though. Before that, like where you're from, where did you graduate medical school, when did you graduate medical school, and like what motivated you to come to the U.S.?
Definitely. I am Mangesh, and I am originally from eastern part of India, a state called Bihar. And I got into med school in 2017. I did my medical schooling from Armed Forces Medical College. It's in Pune, near Mumbai, India. And as the name suggests, it's a military medical college, and it was a very enriching experience. During that time, I was kind of exposed to the idea of pursuing USMLE as a career path, wherein someone who wants to build a career in research, someone who is interested in that, it's a good opportunity. And that's how I got onto this path. I graduated in 2024, including the final year of compulsory internship that we had. And since then, I have been working. I worked very briefly as an ICU physician in India before joining as a postdoctoral research fellow in Houston.
Okay, so you're speaking from Houston right now, correct?
Yes,
How
yes.
long have you been in Houston? 1 year, is that correct?
Slightly over 1 year. I joined in November 2024, so it has been 1 year, 5 months.
Okay, and now the Armed Forces Medical College in Pune that you went to,
Yeah.
just I would presume it's like a competitive school. I mean, obviously
Yes.
medical
Yes.
school is very competitive all over the most places in the world, but
Yeah.
in India, I know it's especially competitive. And also, being the Armed Forces Medical College, I suppose it's a good medical school, correct?
Yeah, yeah, absolutely. It's very competitive, and I think the environment that I got there played an instrumental role in shaping my career forward.
Great. And at some point during that medical school, you decided to come to the United States. Why
Yes.
was it? What were some of your reasons and motivations for this?
I think the primary motivation was that I wanted to, focus on medicine and to pursue research. And before even, deciding to prepare for USMLE steps and decide to pursue this path, I was meeting with faculty members, requesting them for a few research projects because I was genuinely interested in those. So doing few observational studies and working in labs. That's how I started getting in touch with people who gave me suggestions that, if you're really interested in research, doing USMLE is also an option wherein you can be a doctor and also continue working. So that kind of idea was planted in my mind. It was not a one night decision wherein you just go ahead and say, yeah, I'm going ahead. But it took a few years for me to, convince myself that this is a viable path. I'm the first person from my family to venture out of my home country to, pursue a career. So it was scary decision, but I think it's definitely worth it.
Nice. And here you are. I mean, you matched into an
Absolutely.
person in the US. Congratulations. So let's work towards building this portfolio. Like, what is it that you did and when you did it? Let's start with the most basic, which is the USMLEs. Did you start preparing for step one during medical school or after medical school?
So, because I'm from a military medical college, we are supposed to give our steps once we graduate the final year of med school. We can give our step exams when we are in the 1 year of compulsory internship. So
That
that was when I began preparing for step one.
was
So this was
2023. 2023.
so yes, yes.
And did you take it that year or 24?
No, so I gave my step one in March 2023 and step two in December 2023.
Perfect. So you finished medical school essentially with these steps, like same
Yes,
year you had the steps complete.
yes.
You do well on step two, feel free to share or not your score, but like just a general sense, how did you do on step two?
Absolutely. So my step two score was 257. I had prepared for about 6 to 7 months dedicated time while also working on my internship
Okay. Okay,
in my
that's a
med
really
school.
good score. For most people, um, breaking the barrier of 255 is an important landmark. So that's certainly puts you well above average. I think the average now for step two is around 245 to 250. So
Yes,
that's
yes.
well done. Very good. And then so the message I always try to share with people is that you have to build a well-balanced application,
Mm,
strong in multiple components. And I think that's where we're heading because for you, because I always tell people you want to get a really good score, sure, but it's no good to you to get a 270 on step two, but then you don't have any research opportunities. You also
mm,
or papers or publications. But
mm.
also, it's not good to publish 20 papers and also have a very low step two score. So you have to
Yeah.
build a balanced application. So you did extraordinarily well in terms of the steps. I assume you passed step one on the first attempt
Yes.
and then 257 on step two. So that's fantastic. And
Mm,
then comes 2024, but with the steps done, but you didn't apply that year. You only applied in 2025 to start
yes.
in 2026. So tell us why you decided to wait another year if you had already done the steps. Was it because you wanted to build like a research portfolio or what else? What happened in that year that made you wait a full year?
I would say it was combination of both. The primary driving factor was I didn't have US clinical experience back in 24 when I was planning to apply.
Yeah.
And I felt that, without any experience, my application won't be complete and it would be kind of easy to rule out my application whenever program directors or people review it. So I felt in order to apply and have a serious chance at matching, I need to try and check all the boxes which are necessary and required. So I decided that, and during that time, actually, when we were looking for clinical experience, we are just coming out of the COVID pandemic. So not a lot of hospitals and universities were giving out observerships and electives. So that was another challenge. And I thought that I should probably use my time when I'm looking for good elective opportunities, observership opportunities to do some research. And that's when I came in contact with the Meta-Analysis Academy that kind of gave me the right directions and the tools that helped me move ahead in that direction. And I could utilize my time when I was in India. So I was working as a physician in ICU, and at the same time, I used to work on a few projects. I submitted an abstract which got accepted in the European Society of Cardiology as oral presentation.
That's
Um,
that's where we met actually for the first time. It was in London.
yes,
This was
yes. That's when we met. Yes.
September. I'm looking for that picture. That's why I'm looking away. I want to find that picture and share with the group here. But that was September or August 2020.
Late August 24. Yes,
Yeah.
that's correct. That's when we
So
met.
when did you join the Meta Analysis Academy? When was it?
It was in I was part of the fourth cohort of the Meta-Analysis Academy, I think in September 23. So that was right when I was preparing for my step two. So I had attended the classes as much as I could. I think one or two lectures were remaining, and then as soon as I was done, I went back quickly, finished the course, and started working on projects.
So yeah, so that means like within a few months that you had finished, you already submitted to London, to the European Society of Cardiology.
Yes.
You started publishing these papers. So I want to highlight the timing here because Mangesh is going to tell us really impressive results. He had a moderated presentation in London at the European Society of Cardiology. He has multiple papers. I'm going to show at least one of them here that I pulled up. So, but the number of publications that he had is also has to do with the time because he did the program 2 years before he applied. So there's an important constant in research, which is the delta time. Like when do you start and when you start collecting the results? I get a lot of people who say, hey, I want to apply this year. I have 6 months. Can I do something? Well, with meta-analysis, for sure you can, but you're not going to publish 20 papers in 6 months. It has to be very clear to people. Like you're going to build these results, the best results over time. This is one of Mangesh's best paper. He's going to educate us on this, but this is about a year after he started doing meta-analysis. Like he became better over time. So this is an important concept that he did the program second half of 2023, and then he spent 24 and 25 working on these papers, and boom, he matched. And Mangesh, just to jump ahead a little bit, how many papers did you actually have published or submitted at the time that you applied?
I think I had about 25 papers published.
Wow.
Yeah.
That's humongous. And a few of them are first author, like this one, right?
Yes. A few of them are first author.
And the other point you highlight to the group here is the impact. Like this is, I'm going to show this quickly again, but this is catheter CCI. It's a really great journal. It's Catheter and Cardiovascular Interventions. This is one of the best journals in the field of structural heart disease. So the quality of these publications matters a lot. It's not just, publishing a bunch of papers. Mangesh, and before this, I want to highlight too, you didn't have any significant research experience. You struggled to get research done in medical school. Is that fair to say?
I would say I had fair opportunities. I worked as a research assistant in the pathology lab. So that was in my second year. I had a lot of support from my mentors back in med school, and these were like observational studies. But I think joining the Meta-Analysis Academy gave me like an important set of tools wherein I could publish at the highest level and synthesize evidence, which is at the top of the evidence pyramid. And I think that was one of the biggest turning points. Opportunity to learn programming language, to learn statistics, and to do it with doing it independently really did the trick for me.
I think the autonomy is another great component of it.
Yes.
Like some people like Mangesh had great research experiences in medical school, and that's fantastic. Others struggle, but when you learn how to do meta-analysis, you can sort of develop these research ideas, these projects, without having to depend on your medical school or on systems built around you. I actually found that picture. I want to show that picture because it's a cool picture. This is Shenmukh and Mangesh and myself in London in 2024. And for me, this is a very special picture because this is a full circle now. I I'm speaking with Mangesh now, and I met Shanmukh in person here in Boston 2 days ago. And they both matched this cycle. So for me, it's a special moment to speak with both of these students who've become friends over time, and now who are going to be doctors in the U.S., residents in July.
Absolutely.
Congratulations to both of you guys. I saw Mangesh was in the chat here too. Yeah. So that's it for the publications. You did 25 papers. Let's talk about the research fellow. Like, I want to ask you, how was your experience in the research fellow? But I also want to highlight to folks that even for those who want a research fellow, doing the publications before is an important component. I'm sure Mangesh was chosen in part for this position. People looked at his CV. So when they look at your CV and you see, oh, this guy presented at the European Society of Cardiology, he's published some few papers, he's clearly committed and interested in research, and he gets results done. This guy is the real deal. First author papers. So that helps you guys secure a research fellowship position. And how has it been, Mangesh, doing the research fellowship in Houston?
It has been incredible. I would say working with people who are leaders in the field. It has been a very enriching experience, learning from the best. And you get to learn a lot, not only about the standard of care, but also about the current controversies which are existing in the field that our PIs are trying to solve, the questions that are looming over our heads, and they are trying to find answer to that. So getting to help in that endeavor is a very humbling experience, to know the fact that you know so much yet you don't know so many things. It's a very interesting to work in this setting, especially the department where I work with, and structural heart. It has been incredible working past 1.5 years.
That's fantastic. Houston Methodist is one of the best places to train or to be or to work in this country. I had the wonderful opportunity to interview there for a fellowship position. I met some of the people there, and they're leaders in the field, both in cardiology and cardiac imaging and structural heart disease. It's a phenomenal program. So I can imagine what it's been like for you to spend this 1 year there with that group. I mean, I'm sure you've been very productive and very busy too. I'm sure they're working you hard over there. Is that the case?
Yes, absolutely.
If people think that, they're going to do a research fellow and it's going to be easy, but these research fellows, they work a lot. They work really hard.
Yes, I agree.
I'm just going to take a quick pause here to mention, to greet Andres, who said that he's from Medellin, Colombia. And Mangesh is publishing in the field of structural heart disease. So I remembered another one of our students who's also from Medellin, Colombia, who's published in this area. So Juan is from Medellin, and it's so cool that I have Mangesh here, and I'm mentioning the paper by Juan because they did the same version, but for the mitral and for the tricuspid valve. So Mangesh's paper is on the tricuspid valve management, and with the group in Houston, and Juan's paper from Medellin is on mitral intervention. Very similar, same journal actually, and all of these guys are students from the Meta-Analysis Academy: Juan, Sebastian, Mariano, Miguel, Brijesh, Ivo. So it's a great example of a guy from India and a guy from Colombia. They worked on similar topics, but one on the left side of the heart and the other one on the right side of the heart. Right. I think it's a funny coincidence here. Very good. Mangesh, so we talked about the research. Also on the research component, if anyone wants to join the Meta-Analysis Academy like Juan, like Mangesh, like Shanmukh, make sure to click our wait list. Okay, we have a wait list button below. Very important that you guys join our wait list. One of our associates will reach out and explain the program to you guys. So that's in terms of research. Now we talked about the USMLE scores. What about the clinical experience? You said in 2024 it was difficult for you to get those. Did you manage to sort that out in 2025?
Yes, I had the opportunity to shadow my PI in his clinic rounds and cath lab, and that was a very good experience, learning from the best. And just to mention, the patients that are seen in the Department of Structural Heart, these are all, most of them are referred from different centers, and then they are managed. And So we can imagine the level of complexities that are involved in these cases. So it was very interesting to observe my PI manage these cases.
Okay.
Apart from that, I also was able to do a couple of rotations in community hospital settings, and that was another different experience that kind of gave me the view from the other side of the coin, as we say, trying to see how patients present at the primary level, what are the issues, problems with insurance, trying to help patients navigate that. Social factors, I would like to mention something related to medication resistance. People are not very open to taking a few medications because of some ideas that they have. So,
It's kind of
trying to,
shocking, right? It's kind of shocking. You come to the US, like I came from Brazil,
yeah,
you came from India. You think like, oh, over here it's gonna they probably have it figured out, and then you can see that the healthcare system has so many challenges. The patients have so many challenges.
absolutely.
It's eye opening.
Definitely, and trying to see our preceptors, faculty members, in addition to treating them, and in addition to the medicine part, trying to deal with the social part is was something of an, another eye-opening experience for me. That
Yeah.
was very interesting. Um, I would also mention one more experience that I had. I did a rotation in community hospital setting, and my faculty was very keen on me knowing what the management was, and also the reason why management is in place. So he wanted us to know the trials as well. When was it published? What were the outcomes? What were the patient population involved? And then how does it inform his clinical decision making? So
Mhm.
during the rotation, I spent a lot of time reading the patient charts and then going back and reading the trials. Reading about the ischemia trial, FAME trial, ADWORD trial. It was a great learning experience, and I think it gave us a better understanding of medicine as whole. Not just knowing what to do, but why we are doing that.
Yeah. You've just described being a resident essentially. Like
Yes.
you're gonna be well prepared to be a resident in the US because you're gonna deal with all of these things. Um, including the social, the challenges of patient
Yeah.
buy-in for treatment and adherence and all of that. Okay, this is a great question from Ciro here in the chat. I'm going to throw it over to you, Mangesh. He
Yeah.
asked, "What are the expectations doing an observership? Like, how did you manage to stand out? How did you manage to impress? Like, with the right balance between showing initiative and not being like too forthcoming so that like you
Hmm.
bother everyone in the service. Like how did you deal with these things? Yeah, I have another question, but let me go over you first.
I think being attentive and responsive would be the most important thing an observer can do. Trying to pay attention to what the faculty member is trying to explain, being receptive to the feedback that he's trying to give, and then taking initiative. Obviously, taking initiative shows interest, and that is viewed positively by people who are viewing you. And we have to be mindful of the fact, read the room. Whenever we are speaking with the patient, our focus should be solely on them and not on you know uh, other aspects. So that would be the most important thing I can think of, being attentive and receptive to the faculty member.
That's really great. I love this feedback. People usually answer this question more along the lines of make sure you know the patients well
Mhm.
and have a good presentation, be coherent, have a good
Yeah.
plan for the patients you manage, which are all fine. they're all correct, but I really like your answer. Like, be attentive, to pay attention, read the room. I like that. Sometimes you have to stay silent. Sometimes you just have to listen,
Yes.
and
Yes.
you have to be selective when you speak and what you speak. You have to read the room. I think that's a really great advice. Also, related to this question, how did you manage with the research fellow? Because I imagine like you did these rotations in the same hospital where you're working, right?
Yeah.
So like your research responsibilities, they didn't stop because you were doing rotations.
Absolutely.
They still wanted you to write the
Mhm.
papers and do that.
Yes.
So how did you manage to balance those things, or was it really not a big deal? Like, what was that like?
When I decided that I would also seek observerships at community hospitals, first of all, I spoke with my PI to confirm that if it's okay for me to go, and I also assured that any work which is going on, I'll continue working on it. It may be after the rotation hours, but I'll ensure that the work doesn't stop. So that was how I approached it. Whenever something important was there in deadline, I would try and finish that. My observership preceptors were also aware that I'm a research fellow and I might have some commitments during the rotation. So I think I had a great support from both my PIs and the preceptors at the hospitals that
That
helped me navigate both these aspects.
I think there will be individual nuances to all of this, but the general rule is for people who do a research fellow and want to do an observership at that
Mhm.
time is you make sure you don't do it right away. Make sure you spend
Yeah.
some time doing the research and getting the projects going. You do a really good job at those projects so people like
Yes.
you, they trust you, they feel confidence in you. And then you be very clear and you say exactly what Mangesh said. Can I do this? Get permission. And let them know that you're not going to drop the ball in research when you're doing this observership. That's really key. That's critical.
Exactly.
Good. Mangesh, let me go back in time just a little bit. Why did you
Mm.
decide to do the research fellowship when you already had all these papers? I mean, you applied with 25 papers, and I assume that even if many of them were from the research fellowship, you still probably had 10, 12, 15 papers even without the research fellowship. So why did you decide to do the research fellowship?
Uh, I would say primarily because I loved cardiology and I was very interested in research. This was something that I wanted to do before I even decided to pursue the USMLE pathway. So I think getting the opportunity was a blessing. I was very fortunate to get that, and uh, doing that made me, much more aware of the research setting in the United States on what to expect and how to go about that. What necessary skill sets are required, and what are the expectations of faculty members and PIs. That was the experience that I received, and I think that really helped me overall as a physician. And I think it was definitely worth it. Not waiting out another year, putting 1.5 years in as a research fellow. It greatly helped overall.
Yeah, and I'm sure you met lots of great people. You
Yes.
you learn new skills. But I want to
Hmm.
emphasize to everyone here this very important point. Even if you guys do research fellowship, make sure you do research even before the research fellowship so you're a
Yes.
competitive candidate. And then you can do what Mangesh did. You can invite the attendings, your PI and everyone around you in the research fellowship to participate in your meta-analysis. Like Mangesh learned these skills to publish this in the Meta Analysis Academy. But he used that to his advantage, inviting some of the biggest names in cardiology. Dr. Reardon, he's one of the PIs for the core valve trials. I
Yes.
saw him present in ACC when the big TAVR studies were coming out. Dr. Zogby is a legend in cardiology, past president of the ACC, like really, and others over here. Those are just a few names. But Mangesh took the lead. He is first author, and he developed this paper, and he invited these folks to collaborate. So through his research fellowship. So we have a student, for example, who matched in at Harvard for general surgery. She did a research fellowship too, but she invited attendees in Harvard to be part of her research projects. So of her meta-analysis. So this is a really great way of doing it. Learn the skills, develop autonomy in doing this type of research like Mangesh did. That's what we teach in our program in the Meta-Analysis Academy. Very good. Mangesh, congratulations. I'm so happy to see you match. I'm so happy I'm sure your family is thrilled as well. Are they back in India, right? The family, like, are they in Pune? Where does your family live? Or Bihar, you said?
So my family currently is living in Vadodara. It's a different city. They moved after I graduated from med school.
Right.
It's in a state called Gujarat.
Gujarat. Okay, good.
Yes.
Yeah, I'm sure they're super excited for you as well.
Absolutely.
Are you going back home before you start residency in July?
I'm not sure. I would decide when I get the program name and then how things are.
How many programs did you interview in?
I interviewed at 15 programs.
Wow, that's massive. Were they mostly academic, mostly community programs? What was the balance?
It was a balance of both academic and community programs.
Okay. So that's it, guys. That's how you build an application with 15 interviews. We don't know yet where Mangesh matched. Obviously, I'm not going to ask him how he ranked his programs. I'm not going to ask him that question. We're going to find out on Friday where he matched. But he had 15 interviews. It's a super successful application. Again, 257 on step 2, passed step 1 first attempt, graduated in 2023, 25 papers, including multiple as first author, great journals. Research fellowship at Houston Methodist, amazing program. Okay, so that's how you build a really successful application. Balanced application, strong in multiple components. He could have had 20 papers, but if he did very poorly on step 2, it would be a lot harder. He could have had a 270 on step 2, but if he had no publications, it would be a lot harder. So build that balance. Final question for you is from Ronaldo. Would you have done anything differently during the process? Look, I can't identify anything to do different in what you just said, but feel free to say no. But if you know of anything you would do differently, please let us know.
That's a difficult question.
Again, there might be an answer. The answer may be no. Like if there's nothing to do different, then no.
I think preparing for step 2, I would have done a few things differently. As I would have mentioned, it was challenging at that time, navigating steps, giving the step examination, because these are very different from the examinations that we have back in India. I think preparing more and having a different strategy would have helped in hindsight, but I think it's all for the best as of now.
Yeah, no, I think you did really well. I wouldn't change a thing in what you did. I mean, it's a perfect trajectory. And I mean, the match is really soon after graduating too. I mean, you graduated 2023 and you applied in 2025, starting residency in 2026. That's perfect. Guys, don't forget to join the waitlist for the Meta-Analysis Academy, okay? If you haven't joined yet, please feel free to do that. The Meta-Analysis Academy is a global research program for doctors and medical students. Mangesh is part of the academy. We have a nice mission statement here that explains who we are, what we do. As you can see here at the bottom, like our students in the program have published in these really top journals like JAMA Pediatrics, JACC, Lancet, Critical Care, all these fantastic journals. And here are some of the students who've been for our program from like many academic centers in the US. So I would encourage everyone to join our waitlist. All you have to do is come here and hit join the waitlist. Mangesh, I want to thank you for your time. I want to congratulate you again for this great result. You, Shanmukh, and all of our students who matched the cycle bring me a lot of joy. It's a ton of work. I was up until 3 in the morning doing work in the Meta-Analysis Academy. and you've been through the classes. You know what the program is like. It demands a lot
Absolutely.
from myself and from the team, but it's very rewarding when I get to sit down with you and Shanmukh and others who've gotten their match. So thank you for all you do, all your hard work, and thank you for your friendship, for collaboration, for being such a proud ambassador of the Meta-Analysis Academy. I want you to know that it means a lot to me. Thank you very much.
Absolutely. Thank you so much, Dr. Cardoso, for letting me share my stories. It was a great experience. I learned a lot. I made great friends, as you mentioned, through this research journey. I'm very, very thankful for that.
Yeah. You didn't know Shanmukh before, right? You met him through the academy, right?
Yes. I met Shanmukh. I met Doma, another of our
Doma
friends.
is from Egypt, right? Doma is from Egypt.
Yes.
He's in Boston now. I have to say hello. And I had one more question. Are you going to ACC next week?
Unfortunately, no. I know.
All right, I'll be there with some Meta-Analysis Academy students. All right, Mangesh, it's great to see you. Congratulations again on great result. It really makes us all very proud. Congrats to all of you guys. See you later. Thank you very much, Mangesh.
Thank you. Thank you so much. Take care.